A consulting group paid by the state has issued a report suggesting Governor Mary Fallin accept federal money to expand health insurance, something the governor has staunchly rejected. A spokesman for the governor says Fallin plans to meet with Republican legislative leadership to discuss the findings and how best to move forward, while at least one state lawmaker is urging the governor to call a special session to implement the proposal and save Insure Oklahoma.
There are some 32,000 low-income people who have medical coverage through the Insure Oklahoma plan. Insure Oklahoma is funded by combining federal, state, employer, and employee contributions. But because Governor Mary Fallin is refusing federal Medicaid dollars to implement the Affordable Care Act, the feds intend to pull all Medicaid money out of Insure Oklahoma.
They provide about half of all the money that's in the Insure Oklahoma plan. Because of that, the state of Oklahoma will not have the money to take care of that population because we don't have our federal partner that we've had since 2005. That program dies December 31, 2013.
Oklahoma Commissioner of Health Terry Klein says Governor Fallin is trying to get a federal extension for Insure Oklahoma.
The governor is working vigorously to get an extension of that plan. So she has been reaching out to the administration through the Secretary's office and to the administration itself, making the argument for an extension.
Klein says time is of the essence.
We are racing the clock because if, as that is set to sunset in Insure Oklahoma, in December, we would need to put notices out soon, letting people know that they would no longer be covered.
David Blatt of the Oklahoma Policy Institute.
And where the federal government has had objections is the fact that enrollment in Insure Oklahoma is capped. And the federal government's position is we're trying to provide coverage to everybody. We're providing you 100% federal funds to cover everybody. We can't approve the continuation program that says we're only going to cover 10 or 15 or 20,000 people. We want to cover everybody, and we're making you an extremely generous deal to do so.
The final report from the Levitt Partners, the consulting firm hired by the state to research healthcare options, recommends Oklahoma accept Medicaid expansion money from the federal government and use it to underwrite private insurance purchases for poor Oklahomans. State Senator Sean Burge says the report states what Oklahoma Republican leadership should have accepted 3 years ago.
It was all political gamesmanship on behalf of the governor and the Republican-led House and Senate. I hope this gives them the political cover they've been looking for to do the right thing.
Commissioner Klein says it's too early to say whether Oklahoma will accept federal Medicaid dollars.
We don't know at this point until we've had time to fully explore all the options and the repercussions, which aspects of that plan, if any, we will utilize in moving forward.
Burge says he has never understood the reasoning for refusing federal money to implement the Affordable Care Act in Oklahoma.
We're already taking $3 billion a year in Medicaid money in our current health care system through the Oklahoma Health Care Authority. So you're talking about $600 or $700 million more, but all of a sudden that's bad money. But we're still at the trough. We've been to trough for years with Medicaid money coming from the federal government.
Since Insure Oklahoma will be no more after the end of this year, Burge believes legislators need to take action now.
The governor should do the right thing and call us into special session and fix this problem and do what's right for once for these hardworking Oklahomans who want, need, and deserve health insurance.
A spokesman for Governor Fallin says she has no plans to call a special session. Like Governor Fallin, State Representative Mike Ritz has been a staunch critic of the Affordable Care Act and rejects the proposal by the Levitt Partners. He believes federal financial support for Obamacare will not last beyond 2 years at the most, leaving Oklahoma holding the bag.
Once it's in place, like a lot of federal programs, they're going to yank it out from under us, and we're not going to have the support. So you're going to have to come up as a Oklahoma taxpayer. You're going to have to pay double. You're going to have to pay for it as a Oklahoma taxpayer and a federal taxpayer, and then you're going to have to support it once it goes away at the federal level.
The Levitt report estimates that by accepting federal dollars and streamlining the state Medicaid eligibility requirements, Oklahoma could save $464 million over a period of 10 years.
The problem there is the old adage is liars figure and figures lie, and you can tweak it the way you want, but the bottom line, it's going to cost millions of dollars to Oklahoma taxpayers.
Senator Brian Crane also worries Oklahoma taxpayers will end up the losers.
And what happens if they come back in the out years and say instead of the 95% of the 90% we were talking about reimbursing, we can only do 70? I don't want to be the person representing the people of the state of Oklahoma that tells somebody we're cutting off your insurance. I want us to be providing a hand up to people. What the federal government was asking for was a handout.
And while 9,000 of the poorest working Oklahomans will not have Insure Oklahoma anymore, those who have a job make more than the current poverty level, but still can't afford private insurance, will be eligible for affordable health care in the Federal Exchange program on January 1st. Enrollment in the Federal Health Care Exchange starts the 1st of October.
The estimates are that there are over 300,000 Oklahomans who will be eligible for subsidies on the exchange. That whole process is going to be rolling out. Information is starting to be shared now, and beginning in October you can enroll for coverage that will start in January.
Blatt says federal subsidies will pay for a good portion of the cost.